high carbs.
Hi guys, welcome to my high carb challenge. I was going to say channel. Dad, what do you have to say
About high carbs.
about high carbs?
Have some more carbs.
Thank you so much to pizza.
Carbs are for
Dad.
carbs.
Yeah,
Carbs are for carbs.
I'm bringing
more
flaps,
carbs.
bruh.
More carbs. Join us next
Your
time.
mommy is out. Nelly has just recorded.
More carbs.
More carbs.
Okay, more carbs, more carbs.
For more of my videos, click over there and just drop a comment. Let's try and get this to 50,000 likes.
Oh God, I've never said that. Hi guys, this is Yummy Mommy and welcome back to my channel. Today, as you can see, I have my dad back here. Say hi, Dad.
Hi.
Are you happy to be back?
I'm happy to be back.
Okay, you guys really loved him last time and the video was so informative and was very helpful to so many people, so we thought it would be a good idea to have him back. And just like the last one, as I mentioned, this video and this entire series actually about women's health and about our reproductive health is sponsored in partnership with the Junction Mall and Gertrude's Hospital, who, as I mentioned last time, are hosting an event on the 27th of October called, do you remember what it's called?
And it's got to do with the
Pass. Or dial a friend, call a friend. The event is called Mommy and I, and it's basically all about motherhood. It's about learning, sharing, talking about our experiences from conceiving to our pregnancy experiences, to postpartum experiences, everything from PPD to child loss to lactation to breastfeeding, and things like, and our nutrition afterwards, weight gain, weight loss, and those kinds of conversations. So it's on the 27th of October from 2 p.m. to 5 p.m. and the entry is absolutely free. All you have to do for you to attend is to RSVP on their Facebook page, which is Mommy and I. So today's topic that we will be discussing is PCOS, which is something which I only very recently learned is a very prevalent thing, but I guess you're going to give us a lot more information about it. And I asked you guys to send me your questions on Instagram, and thank you so much for sending them. We have about 22 to get through, so I hope it won't take that long, but we just want to give you as much information about this topic as possible. Okay, so the first question, we can just start by just explain what PCOS or PCOS is. Like, what does the acronym stand for and what is it?
PCOS, the acronym stands for Polycystic Ovary Syndrome. Some people call it Polycystic Ovarian Syndrome. Some people even call it Polycystic Ovarian Disease. Poly just means many, okay? Cyst means a bag that is full of fluid. It's like a growth, but it's not solid. It is there's a membrane that covers a fluid in a particular place. Okay, so those are many cysts in the ovary. That's why it's called ovarian. And why it's called a syndrome is that it can present in different ways. One thing which is common in all the patients who have this condition is that they have got their ovaries are full of many cysts, fluid-filled spaces, different ones, and the other symptoms and signs that they can present with is a lot of weight gain. I mean, they'll be overweight. Some can have menstrual disorders, and others may present with infertility or pseudo infertility, in that they might have difficulty in conceiving.
Yeah.
Yes.
Wow. Okay.
Others might present also with sometimes with acne in the face, or sometimes maybe what is called hirsutism, which is maybe hair in places you not expect in women. Sometimes you can see some women with some hair like that, because usually this syndrome usually leads to hormonal imbalance, and therefore that is why they'll present with all these kind of things. and especially menstrual disorders and infertility.
Okay, so is a cyst like a tumor, or it's not like a tumor?
Is a tumor because it's a growth. It's only that it is instead of being solid, it is it has fluid inside. It is not solid.
Okay.
Yeah, it's not like a fibroid. Fibroid is solid.
Yeah.
Yeah.
Okay, so I think you've kind of touched on our second question, because the second question was what entails the definite, like, spot-on diagnosis of the condition. Like when a woman comes with these specific symptoms, you'll be like, definitely she has PCOS.
You not know. You might just suspect it. Especially if a woman presents with menstrual disorders or of any kind, including missing her periods. If a woman has having difficulty in conceiving, you might suspect that she could have that. If a woman is overweight, okay, or suddenly has put on a lot of weight, okay, you might suspect that. But usually the definite diagnosis is made on ultrasound, because when you do the ultrasound, you see, instead of seeing the ovaries being solid, you'll see a lot of cysts within the ovary that is usually solid through and through.
Okay, so with an ultrasound, it's for sure you'll be able to tell that somebody has
Yes.
PCOS. Okay, so out of all those symptoms, are there any which like come first and then other ones come later? Like, what is the earliest sign of PCOS that if I see that sign, I should think, let me go and see a doctor?
Okay, there's none that comes before the other. There's no anything can present fast. Okay, sometimes we just discover, I mean, this lady has been living normally and so on. It's only that now, maybe for the last 1 year, I mean, her periods have been regular, she's not overweight and so on, but without use of any contraceptive, and she's in a marriage relationship, she's been unable to conceive. So for her, she presents with infertility. You see,
so it's different.
So it's different for different people. Some people might come because they have missed their periods and they have not been sexually active. So that might be the what presents.
Okay.
But anything can present for the first time. There's no order.
There's no order. Okay, so can one, now the thing you've mentioned about infertility, one of the most asked questions from you guys was, can somebody conceive naturally if they have PCOS, or does PCOS mean automatically you're not going to be able to conceive naturally?
Conceiving is a problem because because there's a hormonal imbalance, and usually you need some form of hormonal balance to be able to for your egg to be to develop and to be released. And therefore, usually for most people with the PCOS, then it tends to be a challenge to do that. But it's only that also there's different severities, okay? So that you can find that some women might need to be given fertility boosters for that, and others maybe they might conceive without having that. So that if they are not given any medicine, maybe if they want to conceive, maybe it might take them maybe 6 months or a year or something like that, longer. But because of the difference of the severity, that's what I'm saying, others might end up conceiving without even that, and others have to be given fertility boosters.
And so the only way someone can know how severe it is again to go to a gynecologist and to get the ultrasound.
To get the ultrasound, to get the ultrasound, and also even the sizes can even be
reduced,
measured.
Measured.
They can be measured on ultrasound.
Okay.
So that you told you've got about 8 cysts, or how many cysts, and how big they are.
Is it painful? Is PCOS painful?
PCOS is not painful. It's just a condition that one has, but it does not cause pain. Pain is not one of the symptoms that people present.
That's so interesting, because when I think of cysts in an ovary, I automatically just feel like it to be a painful.
No, it's not.
It's not a painful thing. Okay, fine. So now that if somebody, for example, is having issues conceiving, you've mentioned that fertility boosters may be one of the things that they may be given to help them conceive. Is there anything else anyone can do to increase their chances of conceiving if they have PCOS?
Increasing the chances, one of them is to increase the chances. One is of fertility boosters, but the other one is also to eat healthy.
Eat healthy.
Okay, not necessarily low carbs.
Not low carbs. Not all healthy is low carbs.
But to reduce more of fat and processed foods.
Yeah.
Okay, and to diet, to exercise,
So
that at
living a
least
healthy lifestyle.
healthy
Basically.
lifestyle basically, so that then it increases your chances of your body working more optimally.
Okay. So someone else asks, is there any specific advice for postpartum management of PCOS? Is it different from this is a word as prepartum, but is it different from
Antepartum.
antepartum? Really?
Yeah.
Oh yeah, like antenatal,
Yes.
postnatal. Okay, fine. So is there any specific advice for postpartum management, and is it different from antepartum management of PCOS?
Okay, it's not different. It's only that usually for people with PCOS tend to gain quite a lot of weight. Okay, over if they're not managed properly. So maybe they need to be more careful with their diet and exercise, more rigorous than this other group, because usually the problem is with carbohydrates.
Exactly. Carbohydrates, so low carbs. So you see. Okay, another question is, what is your take on using metformin for PCOS management? What is metformin?
Metformin is a medication that is mostly used for management of diabetes. The metformin, people with PCOS tend to have a problem with because of the issues that surround their hormone imbalance. They tend to have a higher intake of carbohydrates and cravings and therefore insulin insensitivity.
Okay. Wow. Okay.
Insensitivity to insulin and therefore increased blood sugar. And therefore metformin usually is because of now the effect of the PCOS, and especially if these people want to like lose weight and increase chances of conceiving, then usually you want to put the insulin to be working well, to be in a good level, and therefore usually you use metformin to reduce
blood sugar
level, because it works by reducing glucose production by the liver, and also it reduces the absorption of carbohydrates.
Okay.
And therefore it helps in terms of weight control in the ladies, and also just stabilizing the body so that then they can be able, especially for those who want to lose weight and those who also want to conceive.
Okay, so then that actually touches on another question where someone had asked, does PCOS lead to diabetes? Directly not, but in the long run it might lead to diabetes because it affects insulin and glucose control. So in the long term it might lead to diabetes and heart disease. Okay, if someone doesn't now actively take care of their health,
Yes.
Because if you do, then you're careful already of those things, so it's unlikely to.
Yes.
Okay, so the key thing is that whole living a healthy lifestyle and whatnot. So is PCOS a curable syndrome? Does it ever go away completely, or it's just something which you'll just have?
It can be made to go away. It will not go away on its own.
Okay.
Yeah. Usually the ultimate treatment right now is for surgery. Okay, because what usually we'll do, we'll go in. It is PCOS is curable, but does not go away on its own. Usually, what we'll do is what we call ovarian drilling. Okay, ovarian drilling just means okay, it's done under
anesthesia. Full anesthesia, sleeping.
Okay, not necessarily sleeping. It can be half anesthesia where we numb
from waist down.
From waist down downwards. What we call spinal anesthesia. So then the gynaecologist usually will puncture those cysts. Okay, because once punctured, it heals as solid, and therefore that is the ultimate cure for it.
Okay.
But there's no medication which will cure it.
Okay.
Yeah.
So you would advise if someone has PCOS that they should go the surgery direction, or is that like an extreme measure?
That's an extreme measure.
Yeah.
Because for most women, the problem is that they are not able to conceive, and therefore they can conceive using medication.
Okay. Yeah.
Okay. So if they are unable to conceive on medication, that is when surgery is resorted to.
Okay.
Because usually these other maybe the weight might not be the problem, or the menstrual disorders might not be the problem. But I mean, if they cannot conceive, that they'll consider it maybe a major issue, and especially if now you have tried medication and it's not working.
Okay. I got an interesting message from a lady who says that she was extremely overweight. She was something like 120 kgs and she suffered from PCOS. And then she lost a lot of weight. I think she went down to around 60, which is almost like half her weight. And she says that after that, her PCOS was cured. So is PCOS actually curable by losing weight, or is that just I don't know?
No. The PCOS will not be cured by losing weight. If anything, the PCOS is a cause of
the weight
gain
to begin with.
To begin with. So maybe she could have just been on something else. Maybe the PCOS and something else was causing her weight gain.
Okay.
Okay, but that just by losing weight.
It's not. Yeah. Okay. So and
We
this
have
one,
had stories of you having lost how many kilos?
a lot.
A lot. And you did not have PCOS.
Exactly, this is true. Okay, another question we got is PCOS something you're born with, or is it like a lifestyle disease?
It's not exactly known whether it is born with or not, because usually even the diagnosis of PCOS cannot be usually found at around about the age of 8, because usually when now one starts to mature and now the ovaries start becoming active, that's when actually you can actually make a diagnosis of PCOS. So
which is at what age?
At the age of is it called first menses.
Okay, so like
men
13,
like about 13, 14,
okay,
when the ovaries now become big enough and mature enough. So I think people are born, maybe they could be born with a predisposition to develop it, okay? Because now you cannot make the diagnosis like at birth or at 5 years. So you only get it later.
Okay.
So, but it's not an infection.
It's not an infection.
It's not an infection. People I think are born with, people are genetically predisposed to that.
So that means that even if I'm living a healthy lifestyle and I exercise and all that, I could still get PCOS?
Yes.
Okay.
Yes.
All right.
And the incidence of PCOS around the world is said to about 4 to 8% of women in their reproductive age group.
Wow,
that is usually from, we say, 15 to 49.
Okay. Someone else is asking, how does birth control, I don't know if this is one of the methods of dealing with PCOS, is birth control, is it?
Okay, usually if there's a growth in the reproductive system, usually you want to not use other methods which are hormonal
yes.
already, because now the hormone is already
hyperactive or something.
Hyperactive, and there's already derangement, and therefore people try not to use anything which is hormonal on them. And sometimes some of these swellings, especially fibroids, but even some of these swellings in the reproductive system might be made bigger by using external hormones. Yeah. So
you would not recommend
So usually not recommend hormonal. And if especially one which will have estrogen. And the other thing is, if you give only one type of hormone, now the balance again
gets messed up.
And
then now you have now other issues now even besides that. Okay. Do chances of infertility due to PCOS increase with age?
chances of infertility, even without PCOS, I mean,
Already, yeah.
I mean, reduction in fertility goes as one ages. So for PCOS people, it will be worse than for people without PCOS.
Okay, so you'd, well, if somebody is married, you'd say the earlier they start trying to conceive, the better.
The better, yeah, because if that is already, if they have already been diagnosed.
Okay. Okay, how does PCOS affect menopause?
Okay, PCOS does not affect menopause per se, because when one comes to menopause, it means that the ovary is already like failing anyway, and therefore the PCOS will not hasten it.
Okay.
Neither will it delay it.
Okay.
It will occur just when
the same.
Yeah, the same.
Okay. Another one says, do the cysts always come back even with good diet and exercise?
First of all, they don't go away with diet and exercise. It's the effects of the cysts that might go away, but the cysts themselves don't go away.
Okay.
So it's not that one day they'll be there and that the other day they are not there. The only cure that you have for them is surgery.
Okay. So if you've not done surgery, those cysts are still there.
Yeah,
it's just that now maybe you might have more chances of conceiving, and probably your menses may be more regular.
Yes.
So then that's what we mean by the symptoms. Okay. How does PCOS affect childbirth? Does it make it more difficult?
No. Once somebody has conceived, whether they have PCOS or not, the outcome is the same.
Yeah.
Yeah.
Okay.
So that you not be, not just because you have PCOS, you not have, your chances of cesarean section are higher than someone who doesn't have.
Okay.
After conception, then the pregnancy is more or less the same.
Okay, that should be comforting. This one, I think you've kind of alluded to it already, because someone asked, medication is not working, what else can I try?
Yeah, if medication is not working, and medication is of different dosages.
Yeah.
If you have tried, usually you try people on a low dose, then progressively increase it. But if you have reached the highest dose and you're still not conceiving, and of course you have looked for other possible causes of not conceiving, and this was just the only thing that was there, then surgery is what now is reverted to.
Okay, we've pretty much covered them all. The last one was, how does PCOS affect one's sex life, especially if they're in a marriage situation? Yeah.
I think it affects it in not directly but indirectly. I mean, first of all, if it's a lady who tends to be, first of all, maybe overweight and so on, so they have maybe
self-esteem
issues, and also if she has menstrual irregularity, she does not know when the menses will come, and so that can affect that. And then if now also at the same time, if she's not able to get children, that might also bring marital stress and so on, and therefore affect the family. So it doesn't affect it directly, but indirectly.
Okay. Yeah. Those are all our questions. Is there any other advice that you'd give to somebody who's suffering from PCOS? The first I would give is that they need to see a doctor, right?
They definitely
for them
need
to be able to know, what, I guess, how advanced it is. Sorry, I have a question. Does it get worse? Like, or is it just that now, today, I have, let's say, 8 cysts, that's it, I have my 8 cysts and that's all, or does it progressively get worse?
Okay, does not increase, maybe might not be, once it's diagnosed, it does not increase in the number of cysts in most cases. What can increase is the size of the cysts, rather than the number.
Okay.
Yeah. So
and as the size increases, the symptoms will likely be worse.
Okay.
So it's advisable that as soon as you suspect, I suppose, using the symptoms that you've mentioned, that you go and see a gynecologist as soon as possible.
Yes.
Okay.
One needs to see a gynecologist as soon as possible. In fact, usually, like we said in our last video, as soon as one is sexually active, then they need to have pap smear and general checkup, which you usually annually,
Yeah.
so that then at least
will
things
be
like a
picked
pap
up.
smear is done and an ultrasound is done.
Yeah, I think that one is very important, and especially for many of you ladies, because I get so many messages of people saying, "Oh, my periods only come once every 6 months," so that's already a sign.
Yeah, that
it's
there
not
could be an
normal.
issue.
You should go and get checked out.
Yes, periods are supposed to come. The normal length of periods
Yeah.
of a
The
cycle
cycle, yeah.
is supposed to be anything between 21 and 35 days. Okay,
Wow, I
so
know that.
if you are outside that, already
It's a problem.
is a problem. But also it can be that if you use to be 21, it used to be 21 days, now it's 32 days, even though both are within
The
what the
range.
normal, it's only that the change is so much
Yeah.
that you need to have something done about it.
Yeah.
And like we said also last week, is that the normal periods usually last between 2 days and 5 days.
yeah.
And therefore, if it is less than 2, that means if it's 1 day, it's an issue. If it's more than 5, it's also an issue.
Okay,
Yes.
so someone should get checked. Okay, so that's the information. Thank you so much for answering all those questions.
Karibu.
And like I mentioned again, like last time, I'm going to leave his contacts down below, and I'll also put it as a flash across the screen because some people were not able to go and check the description box. And you can go and see him. He is based in town at Cardinal, Otunga Plaza, first floor.
First floor.
The first floor, exactly, first floor. And you can go and see him there. So thank you so much for watching this video. If you have any other questions about PCOS that have not been answered here, although I think we've covered most of the issues, yeah. If there's anything else, you can still leave your comments down below or DM me on Instagram, or you can also just see a gynecologist, hopefully this gynecologist, and you can get all the answers to your questions. Again, just a reminder that the Mommy and I event will be on the 27th of October at Junction Mall, 2 p.m. to 5 p.m. Entry is free, just RSVP on the event page. Thank you so much for watching this video, and my dad will be back again for another video in this series about another topic next week, hopefully.
Hopefully.
Are you getting tired? Don't get tired of this video.
No, I'm not tired.
Exactly. It's really important. We love these conversations and be able to help as many of you as we can, right?
Yes.
Okay, so please like, comment, and subscribe to my channel. And until next time, bye.
Bye.